Hi everyone, Dr. Kimberley Sommerville here, your clinical nutritionist and general practitioner. Today I'm going to be talking about insulin resistance. I'm going to be talking about what it is and what are some of the signs that you may have that may be suggestive of it. If you have any factors like possibly being overweight or obese, if you have a strong family history of diabetes in the family, or if you're diagnosed with hormonal imbalances like polycystic ovarian syndrome, then knowing about insulin resistance will be important to you, because once you can know it and treat it, then that will possibly prevent you from developing diabetes. So if any of this is important to you, continue watching. So let's briefly talk about what insulin resistance is. So insulin is a hormone that the body produces that helps the body use sugar, right? So when we eat whatever that is, whatever carbohydrates, if it's yam, dumpling, rice, sweets, insulin is necessary to break down the sugars to its lowest form so our body's organs can use it. Now, when we are resistant to insulin, what happens is that the organs don't use the insulin well. So if our organ, which is pancreas, is going to produce the insulin, but then our organs like probably our fat cells or reproductives like our ovaries just decide that, hey, we don't know about this insulin, we're not going to use it properly, the pancreas is going to start producing more and more insulin, right? In order to help break down that sugar. The more and more insulin you produce is the more and more we're not using it well. So over time, the pancreas gets tired, essentially. And it gets tired, it doesn't produce the insulin well anymore. And when you reach the point of not being produced well is when you're going to start developing diabetes. So if we're aware that insulin resistance is happening in our body, we can reverse it and prevent diabetes from happening. So look out for these symptoms. If you do have them, then you're probably going to want to talk to your doctor about getting tested to find out if you may have pre-diabetes or insulin resistance and how well you can treat it. So the first symptom that you want to look out for is what we call Acanthosis Nigricans. So what this is simply put, is just a thickening and darkening of the skin in some of the skin folds. So that can be around your neck, under your arms, underneath the breasts, and around the groin as well. The skin looks darker than usual. It has a velvety, smooth type of feel. And it's just something that doesn't come off. So it's not that your skin is dirty. Your hygiene is possibly perfectly fine, but it just looks darker, right? And this happens when the insulin starts to increase more and more in the body, because insulin acts on not just sugar, but it acts on your fat cells and it acts on the skin cells as well. So it starts to produce more and more layers of skin with more melanin in there. Hence, you get this darker look in those areas. Sometimes your doctor might just tell you to lose weight if you have this problem, but not everyone who is overweight or obese is going to have Acanthosis Nigricans. It can happen if you are in the normal weight as well. So that is a factor that you want to look out for. If you do see that, yes, it can occur based on different things as well. If you're on chemotherapy or if you're on hormonal tablets like birth control, you might also notice Acanthosis Nigricans, but the factor of insulin resistance is one of the main causes of this skin issue. So the second symptom is constantly craving sweets. Now, craving sweets can just be a normal thing. You know, it might happen a couple times in the month, a couple times in the week, and especially for women when we're in our pre-menstrual phase, right before the period phase, we tend to increase our cravings of sweets just based on the hormonal shifts that are happening. But if you notice that this is a regular thing for you, it's very likely that you may be insulin resistant. This happens again because, as I was saying previously, when the insulin is high but our body's organs are not using it, the organs are not realizing that sugar is already in our body to be used. So if you're not using the sugar, your body feel like, hey, I need some more sugar, so you're craving it, right? Not realizing that you already have it. And this is because the insulin is not working well in coordination with our body's organs. So if you're constantly craving sweets every other day of the month and it's not occurring in like a cyclical pattern like once every month, then you want to check that out for sure. Another one of the factors that we can look at is being tired often. And not even just being tired often, but being tired after a meal. Now, in Jamaica, if you're Jamaican, you know about something called niggeritis. And we talk about this when we have like probably a big lunch, and then right after the big lunch, we get extremely tired, we want to sleep, we want to go home, right? Even though we laugh about this, this is actually not normal. It really happens because our body gets an overload of carbohydrates, and usually that's simple carbohydrates because most of our meals are rice based. So when you have all of that rice at one time, it spikes our blood sugar, and when you spike the blood sugar, the response to that is to produce a lot of insulin, and producing a lot of insulin at one time is going to cause you a little bit of fatigue, right? But if any meal that you have, you find that you get tired probably 1 to 2 to 3 hours after, this isn't normal. Because food in general should be our fuel, right? It should give us energy. We should feel like we can do even more work after eating. But if it's constantly that you're tired, no matter what you're eating, then you want to look into if it can be insulin resistance. Again, there are other hormones like the thyroid. If your thyroid is low, you could be tired all the time as well. But this, of course, is just a discussion with your doctor. So most of these symptoms that I'm going to be talking about aren't necessarily very specific to insulin resistance, but if all of them combined are what you're experiencing, this may be your issue. So the fourth and final symptom of having insulin resistance is persistent central obesity. So what that is essentially just having a large stomach continuously. So no matter what you're doing in terms of diet, in terms of exercise, you find that you always have a little pudge. It can be a little pudge, it can be a large pudge, but if your stomach is generally fat, then it's likely that you have insulin resistance. There is a measurement that should happen in terms of for women and for men, where we call it a waist circumference, which is just the measurement around your waist at your navel. I can't remember the specifics at this moment. Don't quote me, I'm going to put it here, but it's something around where for women your waist should not be over 35 inches, and for men I believe it shouldn't be over 40. If I'm incorrect, I'm going to put the right ones here. But the reason why this is a type of a rule, because when you have a larger stomach, it tends to give you an increased risk factors of having high cholesterol and heart disease, right? So in terms of how this is related to insulin, as I said before, also works on fats. So the higher the insulin is for the longer period of time, is the more fatty acids that are going to be rolling around in your bloodstream. And once they're rolling around in their bloodstream, they eventually find themselves making a home in your gut, because that's the easiest place for it to be stored. We have something called visceral fat, which is just the fat that is around all our abdominal organs, and once that is increased over time, then we'll find that the obesity in our stomach area is going to be continuously there no matter what we do. So if we can actually work on our insulin resistance without even the great exercises like crunches and sit-ups and all of that, we'll find that the fat from our stomach will slowly decrease. So I hope that these were helpful to you. If you found that you have one or more of these symptoms, I would say that you can speak to me. We can do some blood tests, we can do some investigations, or you can go to your doctor to find out if this may be what is happening to you and what are some of the things that you can do to prevent them. If you are interested in finding out how we can curb or reverse insulin resistance, please leave a comment below. I would love to hear it. And if you have any other symptoms, knowing that you are insulin resistant, please share as well so that other persons in the community can learn. Okay, have a great day, guys. This is Simple Summer Naturals, sharing simple nutritional advice for your daily life. Bye.